But for the sake of this video, we're going to speak about what to do after the procedure. I'm going to go through a battery of items that you need to have already bought, so to make sure that you heal in the most healthy, most uncomplicated manner. The very first thing is your medication. You're going to be prescribed antibiotics, painkillers that you need to have at home, and some of them you need to bring with you to the office, such as, for example, the Medrol dose pack. We recommend you bring that to the surgical day in the office so that we can give it to you. Next, you need to get a Listerine non-alcohol, a bigger bottle than this, obviously. You need to get your prescription mouthwash that we were going to also prescribe to you, and then you need to get hydrogen peroxide 3% from over the counter. You need to already have your Afrin, which is this, for extreme congestion, no drip. You need to have your Flonase, and you need to have your saline hypertonic spray that you find at CVS in the nasal decongestion department. Now, this is perhaps the most important item that you have to have at home. When you get home after the procedure, we will already have given you some ice packs, but they don't last long. So when you get home, you have this strap ready, and you have these ice packs. You have 4 of them that come in the package. 2 of them are already inserted here, and the other 2 are always in the freezer. What you want to do is immediately as you get home, you're going to take the strap, put the ice packs inside, wrap it around, and place it like this, and make it tight. It has to be tight enough. So tighten it enough so that you have pressure on the area with the cold. And you're going to stay with this like that. You're not going to be doing any exercise for at least a week to 10 days, at least. And by doing that, you allow the area to heal in the most uncomplicated manner. So these are the items that we have now. I'm going to go item by item so that to make sure that I give you all of the information you need. So you might have bruising, swelling, a black eye sometimes, because when bruising and swelling takes place and it migrates to the eye, this area might become black. If you have bruising and swelling, usually it goes down within 10 days. If you have the black eye, or if you have a lot of bruises, they usually take even up to 15 to 21 days to completely disappear. But expect pain and expect issues such as, for example, increased temperature, swelling in the area. All of that is normal healing phase. So that's one thing. Now, major bleeding should stop within at least no more than a day after the procedure. So you will have bleeding, profuse bleeding even sometimes after a procedure, but it should taper down with time, and usually within a day that bleeding disappears, and then you have oozing. So when you wake up in the morning, you'll have oozing on your pillow, you'll have oozing on your face, you still will have oozing throughout the healing phase, and then it will eventually stop. If you start experiencing bleeding that doesn't stop within a couple of days, or that increases after it had stopped, then you definitely need to call the office for another follow-up. So in case you had received a dental extraction or dental implants, what you want to do is this. We're going to give you gauze to use at home, but you need to buy your own gauze as well so that you have plenty of it. You're going to wash your hands, and then you're going to take the piece of gauze and you're going to roll it like this until it becomes thick enough, like that. Let's imagine one of my teeth is the one that got extracted. So there is a hole there. You're going to take this and place it in the hole. Do not place it in between the teeth. In other words, do not place it where you're biting with your teeth on the gauze. You should be biting, this should be in the hole where the tooth was, so that this contacts the site of the socket where the tooth was. Same thing goes for dental implants. If we do that for you, you're going to place this on the wound, not on the teeth, so that you're not biting on this, you're actually biting on your teeth, and this is sitting where it needs to be. Especially for wisdom teeth patients, you need this all the way far back, not on the teeth, but in the socket, upon this on top of the socket. Also, this, once you wash your hands and you roll it, put it under some running water so that it's actually a little bit wet. Not soaking wet, but wet enough, because if it's too dry, sometimes it dislodges the blood clot, and then you will have something called dry socket. So you want to avoid dry socket by wetting this a little bit and putting in there and putting pressure. So I'll show you how I'm going to do it. Like that. All the way to the back. All right. So this is how you're going to do this. Now, let's talk about eating, drinking, and sleeping. You don't want to eat with a gauze. You don't want to drink with the gauze in the mouth. You don't want to sleep with the gauze in the mouth, obviously. Anesthesia will be given to you at the time of the procedure, and that anesthesia takes time to wear off. It can take up to 6 hours to wear off completely. During that time, you want to avoid drinking or chewing on hard objects or hard food, because chewing on a numb tongue or chewing your cheek might bruise the cheek and might create wounds, and those will take 15 to 20 days to just clear. So we want to avoid anything chewing motion during those few hours after the procedure. The most you could take is a yogurt, an ice cream. All the food that you're going to eat should be of soft consistency, ideally pureed, nothing with kernels, poppy seeds, corn, nothing that it has small little bits and pieces, rice, that can go in those small little holes and get you an infection. You want to avoid that. So yogurt is good, ice cream is good, pureed soups are great. Everything should be room temperature or cold. They shouldn't be warm, they shouldn't be hot. Room temperature and cold, and you want to avoid doing this, taking hot foods for at least 15 days ideally. Now let's speak about sucking, chewing, and placing any pressure on the area that received the procedure. So as a general rule, anytime you receive a surgery, you don't want to stretch the area, you don't want to look, you don't want to be doing this, you don't want to touch it, you don't want to put your tongue in it. You don't want to put any object there, you don't want to touch it, you don't want to dislodge it. A lot of times when the wound is very, very fresh, any movement, even from the outside, can lead to complication. So avoid movements from the inside, movement from the outside. Do not touch the area. Sometimes we do bone augmentation procedure for you and there is a little bump there. Don't touch it, because you will dislodge it and it will not heal very well. So if you feel that your mouth is full of blood and you need to spit it out, always spit passively, never spit forcefully. Let the saliva or the blood drool or droop out naturally from your mouth into the sink. Do not do it forcefully. This applies to the time from the early healing, even to a few weeks after. If you still have a little bump there, that's the bump that we needed to augment the bone, you don't want to be touching it because you don't allow it to heal. So now, brushing. During the very first 2 days, you're going to take alcohol-free Listerine, no toothpaste. Toothpaste foams a lot, it soaps a lot, and so if you want to avoid gargling too forcefully, and I'm going to show you how that translates in the mouth, you don't want to use toothpaste because it foams a lot. Instead, you're going to be using alcohol-free Listerine, and I'm going to show you how to do it. So essentially, you're going to take some Listerine, and you're going to take your toothbrush, and you're going to go to the sink and do this. So let's imagine that the work was in the top front teeth, for example. That area, you want to avoid brushing it. You're brushing everywhere else very well, but you're not brushing that one area. I'll show you how that looks like. All right, so you saw how I cleaned my mouth. Obviously, you should do it for 2 minutes, not just a few seconds like that. Once you're done with those 2 minutes of brushing, the only area that's missing right now is the top, correct? So I'm going to show you how to clean that. Alright, so we brushed our teeth with Listerine, non-alcohol, for the exception of the area that received the surgery. That could be here, here, anywhere it is, right? So then what you want to do, take hydrogen peroxide and pour some in a cup, and you're going to take some Q-tips, and let's imagine we did surgery on this gum tissue here, or we took this one tooth out. What you want to do is come with a Q-tip and clean the teeth like that, and clean the teeth like this, and do the same from the back, but do not touch this area that was extracted. Do not touch that area, just clean on the sides like this, clean on the side like that, and do the same here and here. That way you're not putting pressure at all. So now you're done with this, you're gonna take the Listerine non-alcohol, you're gonna put it in the mouth, and I'm gonna show you how you're gonna use it. You're gonna essentially put it in your mouth and let it sit there for 2 minutes. So the way you're going to do it is like this. Did you see that I did not gargle? You don't need to gargle. When you gargle like this, all the grafting that we usually place in the mouth is lost because you put too much pressure like that. So you want to avoid doing that completely. And the way to gargle is not to, is to place it in your mouth for 2 minutes, move your head around, and that will help clean the mouth for 2 minutes without any gargling. All right. So we are done with the gargling and all of that, and this is for the first, specifically for the first 2 days that you're using Listerine non-alcohol. After 2 days, the third day, you're going to start using chlorhexidine Peridex, which is the prescription mouthwash that we would have given you. On day 3, you're going to do exactly the same routine with Peridex, not with Listerine anymore, because now we need a stronger medication to prevent any infection from happening. So that was the essentially the cleaning part of it. You're going to do this for 3 times a day, and you're going to avoid water pick at all costs for at least 2 to 3 weeks. No water pick whatsoever. You're just using the toothbrush, the Listerine, and the Peridex throughout the healing time up until 15 days when we take your stitches off, and then you could resume brushing normally using toothpaste as well. Pain management. You're already prescribed ibuprofen or Tylenol or both. This has been in the research shown to be equal to much stronger medication that we do not prescribe. We prescribe only a combination of these two medications, because those two together have been shown to be equal to the stronger ones. So we don't prescribe stronger ones anymore. The way to take it is that ibuprofen, let's say you do take ibuprofen, you're going to take it at the time of the procedure and continue taking it every 4 to 6 hours. Let's imagine that the ibuprofen alone is not enough. You still have headaches, you still cannot sleep, you still have tremendous pain. You're going to add Tylenol on top of that. So the way to do it is to alternate. Let's say in the morning at breakfast, you're going to take ibuprofen 800. And then at 10 a.m., you're going to take a yogurt and take a Tylenol extra strength 500. At 12, you're going to take another ibuprofen with lunch. And at 3, you're going to take another yogurt and another Tylenol. At dinner, you're going to take another ibuprofen. And at bedtime, you're going to take a Tylenol. Alternating like that will help get you the best results, especially early on in the healing phase. You need to stay well hydrated during the healing phase, and please get a multivitamin that has enough vitamin C and enough vitamins in general to keep you in a good status of health, so that the tissue can heal quickly because you're not missing on vitamins. When do you start eating after the procedure? Usually after the numbing wears off, meaning 3 to 6 hours, you could start eating, as we spoke about, colder foods, room temperature foods, pureed foods, no kernels, no poppy seeds, no corn, no rice, nothing that can go into a hole and get stuck and get infected. So always think about it as pureed. Get all the food you like into a blender and then eat that for at least 10 to 15 days until the hole closes completely. So now smoking. You should avoid smoking for at least 10 days after the procedure. This is extremely important because smoking has nicotine. Nicotine reduces blood supply and it causes the area to open up, and then you will have infection and inflammation. So smoking is an absolute no-no. Drinking alcohol, you could start at day 3, 1 drink per day. That's 1 glass per day for the healing phase. And then you could resume drinking normally. If you have hanging sutures, also make sure that you don't touch them until you come to your follow-up, where we're going to actually either clip them for you or take them out if we need to. But do not play with the sutures, do not cut them yourself, do not your fingers there or try to play with them. And that concludes this portion of the what to do after your procedure. I hope it helps.